When we go into fasting state, we can see that our healthy cells kind of come down into this like protective repair mode. So they get into DNA repair, we go into autophagy, and our body's trying to kind of clean this stuff up. We go into this kind of quiet mode, right? And cancer cells often have these like oncogenic mutations that prevent them from going into those protective responses. So they remain in this growth state, making them more vulnerable to things like chemotherapy and stuff. Hey everyone, Derrick Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. All right, my friends, welcome to another episode of the Pain and Performance Podcast. I hope y'all are doing very well as this catches you. So this month we have been talking a ton about cancer research, cancer treatment, and I wanted to record kind of the latest update on all the science that we can find for adjunct cancer treatments and recovery. So we're going to do some deep dives into things like diet for cancer treatment, fasting-mimicking diet, which we've talked about a bit on here, some of the latest updates on exercise, cutting-edge therapies that are out there, and how those can alter things like cancer outcomes, growth, all of that fun stuff. So I'll mention it now that October 31st, Halloween Day, here at the office, 911 Harding Street at the Hero Health Spa side, we will be doing a full day of fundraising. So we're going to have lunch tickets that people can do. We're going to be providing things like cryotherapy, infrared, sauna, laser therapy, all of the therapies that we do on that day. All of the money is going 100% to cancer research, cancer treatment. People are going to be able to kind of do some auction items, bid on some auction items. It's going to be an amazing day. We'll have some Halloween contests as well. So costume contests, come ready to have a great day and really get involved with this great thing. And one of the things that you want to look at is, over the last few years, we have made great strides in cancer outcomes. We've seen significant improvements in the number of cancers that we are able to treat very effectively. And when we look at many common cancers, if we're catching them in earlier stages, stage 1 or 2, our outcomes for many of the common ones are well above 90%. So we are making great strides. I'd be remiss to say I think the next big step is going to be in 2 areas. It's going to be in early stage diagnosis for cancer. If we can catch it earlier, it gives us such a better kind of array of treatment options. And then I think in adjuncts, as we continue to get better and better ways of combining therapies, we'll see some significant improvements in there. So the first thing I wanted to talk about on here is diet and metabolic adjuncts. So we're going to talk about some of the different diets that have been used in cancer treatment. So most cancers display something called the Warburg effect. If you're not familiar with that, it's a reliance on glucose or glycolysis rather than oxidative phosphorylation. Basically, this means that cancers love glucose. They thrive off of glucose. So I'll say it right now. Also, I'm going to talk about cancers as a whole in many of these situations. I will get into kind of nuances of different types, but cancer is an umbrella term with hundreds of different diseases underneath it, and they all act a little bit different. So we do have to be a little careful, a lot careful in saying that something that works for one type of cancer works for all types of cancer. That's not the case. So if we are looking at cancers that are having this heavy reliance on glucose, then restricting glucose via ketogenic diet, fasting diets, whatever that might be, might stress cancer cells more than they would healthy cells. At least that's the prediction, and there is good research that follows that up. When we look at certain ketones, if we're in the ketogenic diet, our body uses ketones for energy. One of those beta hydroxybutyrate has been studied as kind of a signaling molecule that seems to reduce oxidative stress and improve mitochondrial resilience, meaning our healthy cells stay functioning well, but cancer cells can't use that energy to function, and that weakens them. And so that's the idea behind the ketogenic diet. So what does the data say? I think it would be my question on that. And when we look at this, there's been a number of studies that have been done around like the ketogenic diet in animal models and some in human models. In pancreatic cancer in a mouse model, what they found was combining the ketogenic diet with an anti-cancer drug led to tumor suppression, whereas the drug alone did not do that. And so getting into that ketogenic state weakened the cancer cells enough to make the drug effective. So interesting enough, in a pancreatic cancer model for people, when we look at breast cancer, we have to be a little careful with these things, because there was a study that showed that while the tumor growth lessened, it seemed like there was a metastasis, a slight increase in metastasis for breast cancer. So I have to put that out there. Like, this isn't something that this is again in a mouse model. So these are in animal models. We can't use everything. It still suppressed the primary tumor growth, but there was an increase in lung metastasis. So we're like, you're having to kind of tweeze these things out. I think when we look at a lot of the dietary changes, there's things that you can see that jump out in terms of tumor suppression. So there's many of these things that I think are quite helpful whenever we're talking about sulforaphane. If y'all have heard us talk about that, that's something that Rhonda Patrick has talked about a lot, in its ability to have an anti-cancer action, if you will. So I think if we look at ketogenic diet specifically, let's stay there for a minute, and I'll get to some of the stress and symptom changes. The most interesting finding is that I think the ketogenic diet can, with certain drugs, make them more effective, certainly in pancreatic cancer. Quality of life seems to suggest that ketogenic diet can improve energy production for people in many types of cancers. We need to make sure that we're observing everything very, very closely as we're going through dietary changes with cancer. But there has been interesting outcomes whenever we're looking at being able to add or alter our diet changes, and what that can do for cancer cells. So another big area that we have talked about is fasting, or fasting mimicking during cancer. So if we look at some of these things, healthy cells under fasting state can downregulate their growth pathways. When we go into fasting state, we can see that our healthy cells kind of come down into this like protective repair mode, if you will. So they get into DNA repair, we go into autophagy, and our body's trying to kind of clean this stuff up. We go into this kind of quiet mode, right? And cancer cells often have these oncogenic mutations that prevent them from going into those protective responses. So they remain in this growth state, making them more vulnerable to things like chemotherapy and stress. So this is the whole reason why fasting becomes an exciting treatment opportunity, is that it in very real measures protects our healthy cells and sensitizes our cancer cells. And if you've listen to us or talk about fasting, you know that we've talked about the work of Dr. Valter Longo. He wrote a wonderful book called Fasting Cancer that goes through very specific cancer types. But there's been a lot of studies that he's done and his team has done that show what the benefit of fasting plus cancer treatment can do. So he recommends something called a fasting-mimicking diet. So it's not just pure fasting. You are eating a plant-based diet for 5 days of a very low calorie, like 700 or less, or 800 or less, somewhere around 700 calories for most of that. That kicks on all these great mechanisms, but it still is feeding your body a little bit so that your kind of hormone and muscle mass production continues to stay up. When we look at some of the studies, the fasting mimicking diet lowers circulating glucose, it lowers insulin, it lowers IGF-1, insulin-like growth factor, reducing the proliferative signaling of our cells. And what this does is basically kind of shifts metabolism towards ketosis. So there's a little bit of an overlap. You won't get as full like ketogenic, and it's a short-term thing. But when we go towards that and we're in fasting state, this stresses the glycolysis dependent cancer cells. So they're not getting fed and they're weakened. So whatever treatments we're doing are just that much more effective. You're treating these stressed, weakened cancer cells while our healthy cells kind of go into this quiet protection phase. So when we look at human trials, basically we found that going into that fasting mimicking kind of program, they had about an 18% drop in glucose, a 50% drop in insulin, a 30% drop in IGF-1 after these fasting mimicking kind of protocols, all appearing to improve the cell response to cancer treatments. He goes through, there are specific mechanisms of what type of cancer you would want to do what, but I will say in general, again, like if you're trying to do this for specific cases, go look it up. But in general, what he has found and what they recommend is that we get into a fasting state as we come up to a chemotherapy cycle. So let's say somebody has chemotherapy on a Wednesday, then on Sunday, they would start their first day of the 5-day fasting mimicking protocol. It's 5 days. That way they would be on day 4. So they're deep into fasting state. Their healthy cells are kind of down in that protective mode. And it's been long enough to get those cancer cells into this weakened state. And then we would go and do chemotherapy. We'd have another last day. And then we would return to our hopefully modified diet, where we're basically still going low in glucose. We're going lots of whole foods. We're adding in lots of really healthy greens. We're adding in lots of like colorful foods, dark leafy greens, and making sure that we're getting all of these kind of like, anti-tumor growth factors of like sulforaphane and others. So that's kind of how the fasting mimicking diet works if we're looking at this stuff. The trials in humans have shown significant changes for many of the different types of cancer, and they've used it in different way. They've looked at in mice where fasting or the fasting mimicking diet reduced chemotherapy damage in the normal tissues, in the bone marrow, in the stomach, and enhance the anti-cancer effect. So these are studies that have been done where in animal models we can test everything. In humans, what it has shown is that patients tolerate chemotherapy better with fewer side effects. They had less nausea. They had better quality of life measures. They felt better throughout, had more energy even throughout the chemotherapy treatments. And sometimes this really does help us go through treatment longer, is that we're able to handle this. And I think there's a lot of synergy there where our healthy cells are still doing okay. I can handle more treatment if I need to. And my cancer cells are hopefully dying faster. I think this is an area that will be very interesting over the near future. There was a study that I thought was pretty cool in mouse models with colon cancer, where they combined fasting mimicking diet with high dose vitamin C, and that had a really strong synergy, especially in tumors with KRAS mutations, so a type of mutation that makes, I think, tumors a bit more resilient. So when they combined both of those, they had a very good effect on tumor death, on tumor changes. So this is where these stacking things can kind of come in and start making us have some power and have like a multiplication effect. One little thing that shows, that we get a 2 or 3% change in tumor death, but we get a little bit of an increase in immune health and a little bit of an increase in healthy cell preservation. Those aren't independent. You're not like, oh, that's only a 2% change. Those are multiplication changes, multiplied changes that start to really grow as that effect continues and takes hold. So I'm excited by what the preclinical studies show of fasting mimicking changes. There's really good studies on breast cancer. There was a great study. It's called the DIRECT trial. If you want to look that up, DIRECT trial. It was on HER2 negative stage 2 and 3 breast cancer patients, and they randomized them to a 3-day fasting mimicking diet prior to and during chemo versus a regular diet, and they found that a 90 to 100% tumor loss was more likely in the fasting group, the fasting mimicking group. There was no difference in toxicity. I think in some of these, anybody who dropped out of that, it was a compliance thing. Is like some of the patients dropped out because they couldn't do it, or they were having difficulty following that. What I would say for some of those things is if you have never done any like intermittent fasting or prolonged fasting, it probably makes it harder. The first time you do it, it's a challenge. Your body doesn't have that mechanism very well. Now, y'all have heard me talk about this on here. I think everyone a few times a year should get into a fasting state. If you can do that and you maintain muscle mass and strength and you're prioritizing a healthy, whole foods, protein forward diet throughout your regular year, going into a fasting state is going to be a great thing for everybody. Talking about preventing cancer, it does so much for that. These studies are done in current cancer cases. But what I'm saying that for is I think I would be interested to know if the people who dropped out had ever done any form of fasting in the past. It certainly makes it more challenging for them. There was also a study done in Iran on fasting mimicking diet in breast cancer cases, and the fasting mimicking diet group saw reduced insulin-like growth factor, CRP, so inflammation, and had better radiologic and pathological responses, just better overall. So small group, but still showed really good changes in that. Not to keep going on with it, but there was another study that was just looking at the safety of a fasting mimicking diet with cancer. They did this on 100 cancer patients. They checked everything, and what they found was the same thing. Like they reduced glucose, insulin, IGF-1. They decreased some suppressive myeloid and TREG populations that often we'll see like increased kind of changes here. And this just showed that it was safe. This was only a safety trial, and it showed that it was safe. It didn't measure like tumor shrinkage or survival or anything like that. But still, to know that we can go through this, and there are studies that show great improvements, that is helpful enough for all of our cancer patients to say it's an option. and we should have that conversation with our doctor. Hey, I want to try this. It gives me some control. And, in my type of cancer, again, go and try and pull the data, whether this is breast or prostate or skin or whatever it might be. Then can I use this as an adjunct therapy to help improve my outcomes with this? So I think the human evidence is still pretty early, but it is exciting when we look at things like colon cancer, breast cancer, prostate cancer, skin cancer, some of the high dose vitamin C with fasting mimicking diet seems kind of fascinating, just because I enjoy the combination of how things can work together to improve outcomes. So when you look at the combination, they seem to show better tumor suppression, more than either one alone. The fasting mimicking diet probably sensitizes the cancer cells and resistant cancer cells. So it strengthens those healthy cells and makes them resistant, and then it weakens the cancer cells. So this is a really neat area. Without nerding out on y'all too much, it's got some deep pathways that are happening whenever we're going through this. But I do think the timing matters. If we're looking at it, the most positive studies on fasting mimicking diet preceded like chemotherapy. So they did it like right before for a few days to get into those protective states. And the sensitization effects seem to be strongest when the fasting mimicking program was right around chemo. So that direct trial that I was talking about did the 3 days before and the day of chemo. And I think that's why Dr. Longo recommends starting like roughly, 3 days before, 4 days before getting into it, and still having that one more day after, like a chemo treatment, to show, good improvements. I think a lot of people talk about compliance as an issue. I don't know that there's a real way around that, other than like if we have a risk for cancer, like y'all have heard me talk about on here a lot, then we should be doing some version of fasting mimicking protocol yearly, a few times a year anyway. And I think that would make it a little bit easier. If God forbid we get into a situation where we do need to beat cancer, then we have some of these mechanisms available to us, and probably an easier treatment, if you will. Look, certainly, again, y'all will hear me say this, that none of this applies to every type of cancer, but there are many of them that are very glucose dependent. There are some that are less glucose dependent or have slight mutations. So we do have to kind of look at the specific cases for those. But by and large, if you look at Dr. Longo and his colleagues, they've shown that definitely in mice and in a lot of humans, the fasting mimicking diet, if it's paired with chemo, can protect healthy cells and make cancer cells more vulnerable. So this is basically the stress resistance versus sensitization, and our healthy cells do great. In the direct trial for breast cancer patients, those with the fasting mimicking diet had significantly higher odds of stronger tumor response, 90 to 100% cell loss compared to the controlled diet group. So that's a very, very good change, given that it was a human randomized controlled trial. And then in the large safety trial, we find that patients are able to tolerate it. It improves a lot of things. It does show great safety profile. And so I think the big thing around at least the fasting mimicking diet stuff is that it reduces immunosuppressive populations. So like regulatory T cells, this will get a little bit nerdy, cytotoxic T cells, natural killer cells, and kind of puts the immune environment in favor of cancer control. So that would be kind of what is happening there. And we can use this to our benefit. If we're looking at shifting it off of diet and we're going into some exercise and physical activity. I think exercise is probably one of the strongest things that we can do to help improve our health during cancer. It's one of the strongest non-pharmacological tools that we have available to us. It doesn't kill cancer directly, but it certainly improves our immune system, improves our metabolism, improves our resilience, and kind of reduces that frailty that we can end up in, and helps us tolerate all of the treatments that we can look at when it comes to cancer. Definitely improves quality of life to a significant degree. So if we use exercise as a prescription in cancer, we need to look at volume and intensity, but we're trying to maintain muscle for sure. So some form of resistance training has to be in there. And we are trying to kind of reduce the energy losses that happen along the way whenever it comes to cancer and radiation. And if we go through that and we kind of look at the immune part of it, so exercise tends to improve natural killer cell activity, which are the cancer fighting cells. So kind of the on the same level that fasting can weaken a lot of the cancer cells, exercise actually comes behind and boosts up our natural fighting response. And it certainly can make changes from an inflammatory standpoint of reducing tumor necrosis factor, reducing IL-6, reducing CRP. So all of these markers of inflammation can come down with exercise. And all of this, again, starts to change the environment in our body to make it very challenging for cancer to stay there, especially if we're coming behind and treating it. Another thing that I think is worth looking at with exercise is vascular perfusion. We're moving and we're getting oxygen to all of our tissues, which may help drugs access tumors. We'll talk about PEMF in a little while, but PEMF is another therapy that looks like it does that really well. So that's something that exercise does a very good job of, is kind of getting the treatments to the tissues that we need. A lot of areas where we start to develop cancer, if we're not getting blood flow into those areas, we're going to have trouble getting chemotherapy to the tissues that we need to treat. And here's the synergy of all these things. Let's say we're exercising, we're going into some fasting mimicking states, and we're able to calm or lower the activity of our healthy cells. And then we're still doing some exercise and getting blood flow. And because we're exercising using our energy stores, cancer cells are still going to be revving up. And then whenever we're sending blood flow throughout the body, those cancer cells get hit with that harder than our healthy cells would. So it's this is where this multiplied effect starts to really take hold with it. There's a bunch of key studies when we look at these things of trying to track exercise probably gets a little bit difficult. So some of these are kind of epidemiological studies, but in general, they show that higher physical activity is associated with lower cancer incidence and better survival rates. Breast cancer, colon cancer, prostate cancer, and in breast cancer survivors specifically, moderate to vigorous exercise is linked to reduced recurrence and mortality. So it does tell us we are making changes to the body in a very positive way that don't just affect our recovery now, but affect our recovery later. So what happens after we come out of cancer? We want to do this so that we can heal and get to a point where we feel great about what we've done and what the environment in our body is not one that's conducive to cancer wanting to come back. And I think physical activity is a very big one for some of those things. So exercise has to be part of the program. What does that look like for people? I think that depends on the history there, is like, what have you done? That might be walking. I would say make sure we're doing some version of a cardiovascular exercise, walking, getting a little lightweight vest and going for a walk, so it's a little more in the zone 2 world, and trying to get that in a daily activity, and then having at least 3 days a week of us doing resistance training. So when we're looking at all of our cancer patients, we are trying to get them using something called Katsu. Katsu is a great way for us to increase muscle strength and muscle mass, something we're trying to fight very rigorously without increasing like inflammatory markers from really stressing the tissues. So that's an easy way for us to do it. That's something that we can do kind of to cheat the system a little bit. Again, if you're doing any different types of exercise, I would say make sure you're working with a professional. Make sure that people are watching and checking things, and y'all are adjusting based on little small changes there. But I think by and large, every doctor should be using exercise as a prescription when it comes to our cancer patients. There's too much information out there that shows good improvements in outcomes, good improvements in quality of life, and all of the above. So I think make sure that is part of our lives, that is part of our treatment protocol whenever it comes to cancer treatment, cancer outcomes, and quality of life. So we've talked about changing diet stuff. We've talked about exercise. I'm going to get into some of the more like cutting edge therapies that have been out there and some of the myths around them. The first one I want to talk about is PEMF, so pulse electromagnetic field therapy. This has been around for a while. PEMF modulates the cell membrane of our cells, enhances ATP production, so improves mitochondria function, reduces inflammation, and influences calcium channels. That's a whole lot of words. Very often it's thought of as a vascular therapy, where it's helping get blood flow. The reason it helps improve blood flow is because it does help our cells move better throughout the body, because it's affecting the cells themselves, like the membrane of the cell. Where that comes into play, the reason I bring that up, where it's not just like a vascular therapy, is that when they look at this, it seems like it can influence apoptosis in cancer cells selectively, very specifically to cancer cells. When they get bombarded with this field, this like electromagnetic field that our healthy cells like, our healthy cells start to move better, start to function better, so they get smoother, our blood vessels dilate, helping get blood flow deeper into all the tissues. This goes back to kind of exercise. On top of it kind of negatively affecting the cancer cells and influencing apoptosis, where they die faster. The vascularization and angiogenesis really helps us get any chemotherapy that we are undergoing into all of the cells in our body. So it kind of helps get that deeper into the tissue that needs it. That's an exciting kind of change. I've seen this used very well in many, many cases. There was a study, I think it might be just as simple as the mechanisms and therapeutic effectiveness of PEMF. And what they found was in vitro, so like in a dish, right? PEMF inhibit proliferation of cancer cells. This was cancer cells, if I remember correctly. And normal cells were not affected. So this is exciting. It is in vitro, and there's a lot that happens. There has been a number of studies that were done to look at the health effects of it, showing that PEMF is a healthy thing for us to be doing. We are getting changes in terms of blood flow. And I think there was a little bit of a worry at some point years and years ago, like if we increase blood flow to it, does that change or encourage any cancer changes, and the opposite seems to be true, is that if we are getting that area oxygenated, we are delivering treatment, we are delivering helpful cells and things that can modify those cancer cell activity. You will actually see a weaker cancer cell if we are doing PEMF. There was another study that came out like this year, if I remember correctly, that showed weekly therapy of weekly PEMF therapy modulated like pro-angiogenic factors, growth factors, in healthy volunteers on like breast cancer cell lines, suggesting that it's a nice non-invasive treatment to breast cancer. So a lot of these pathways for something that you can lay on there, basically to give y'all an idea what PEMF looks like, we lay down on a mat, the PEMF turns on, and it seems to basically give you like this relaxation effect. All of our patients are like, I feel like a light little buzz, and it seems to kind of calm me down, if you will. Then a lot of times, I'll talk about this in a second, we pair it with infrared therapy, so the infrared light therapy. But in doing that, you relax. We take people out of a stress state, and I don't think that's a small thing. When you look at PEMF, there's been a lot of studies that show that it encourages a parasympathetic state, a relaxation state. And I do think that that is very helpful in cancer treatment. It is one of the most stressful things for us to hear. So that if we can have these regular, 3 times a week, 4 times a week, kind of calming therapy while it's helping my healthy cells, while it's weakening my cancer cells, it seems like a very low barrier to entry treatment that checks a lot of positive boxes. So PEMF has shown selective inhibition of cancer cells, while normal cells remain less effective. So just to give you like the 30,000 foot view, I think the most of the human work suggests that it can modify the angiogenic factors that are often there with tumor growth, blood supply, all of those things. I'd be interested to watch that research over this next little bit. And then it definitely improves symptoms. So a lot of times in neuropathy caused by cancer treatment, PEMF is one of those things that seems to relieve those symptoms. So again, that we can kind of handle the treatment better. One of the things we combine in our office with PEMF is photobiomodulation, infrared light therapy. And I think this is one of the areas that has gotten a lot of press. It increases mitochondria. It uses near infrared light to go in and boost ATP, the energy that your cells produce. There are some other things. It lowers our reactive oxygen species, so kind of an antioxidant, if you will. And then that helps us reduce inflammation and promotes tissue repair. So that's the mechanisms of near infrared therapy. In oncology, it seems to be used to mitigate side effects in a lot of cases. So a lot of the inflammation, the neuropathy, dermatitis that comes along with it, and improve immune function and the therapeutic responses of the treatment that we are getting. So there's been a number of studies, and this gets a little bit challenging for a lot of the patients that we talk to, because somewhere along the way there was is this going to make it seems to be, it's energy producing, and it could be growth factor producing. Is this going to increase my risk of tumor growth or recurrence or anything like that? And if we look at some of the best studies that we can find out there, I think this is an infrared type discussion. The devices that do near infrared often are sending a irritating infrared light into the body. So in the studies that have studied that type of near infrared, what they find is that it does not increase the chances that we have cancer growth. And in fact, it might actually inhibit some cancer cell growth with near infrared therapy. So this is where things get like we need to be nuanced with it. The studies that we can find around specifically near infrared therapy uses a type of light that gets absorbed into the body, into the cells, and our healthy cells can use that very well to produce energy. The cancer cells apparently cannot do that very well with near infrared light. It also seems to stimulate kind of anti-cancer immune response by basically triggering certain types of cell death. So cells that are not functioning well or precancerous and could be converted into cancer seem to die, which causes some of the cellular contents in that to activate the immune system and help attack the remaining cancer cells. So this is what the body of research seems to be showing on near infrared therapy. If you look at different studies, there was a systemic review in 2024 where they looked at 23 studies on photobiomodulation and laser. They put them together. Not super happy about that, but part of it in oncologic practice, and the evidence supported that they improve the quality of life and reduce side effects of cancer treatment. Again, this isn't something that we're like, hey, this is going to change the ability for us to treat cancer, but this absolutely changes how the body can handle those cancer treatments. Varsani is a researcher that put out a study in 2024 and said that, look, if we use photobiomodulation, it seems to improve patient compliance, reduce their pain, improve their immune responses in cancer settings. So this is something that I think helps boost us up and improve all of our healthy cell function and does not improve cancer cell function. So when we put that with PEMF therapy and somebody is doing those together, I think there's a lot of good that happens. If we in our office are looking at a treatment protocol for these things, that's one that I want people doing multiple times a week, like upwards of 3 times a week while they are going through cancer treatment. Something that is very good, shows really good therapeutic effects, and there's research that backs the mental and the cellular changes that happen there. Something that we get asked a lot is things like cryotherapy, sauna therapy, or thermal stress. So when we look at this, these are hormetic stressors, and we're trying to do these at the right time, whether it's cold or heat. These upregulate these cold or heat shock proteins that have a lot of downstream positive effects. The more we're releasing cold shock proteins or heat shock proteins, the better a lot of things are functioning. Both cold and heat, believe it or not, improve circulation and definitely improve immune function. There's been tons and tons of studies on both of those that show improvements in inflammation, decreases in CRP and IGF, changing again the environment inside our body to suppress anything that would help tumor growth and improve anything for immune function. Heat, while I'm not talking about cold exposure, has been more studied as a cancer adjunct. Apparently heating tumors, again, helps with drug perfusion. We can get that better blood flow. If you get in a sauna, you're getting blood flow throughout the body. And that's something that we would want to look at. The way we have programmed that is after chemotherapy at that point. So somebody would go through a fasting mimicking protocol. They would be doing PEMF and infrared leading up to it. They would have a chemotherapy day. They would have one more day after where they're still on the fasting mimicking diet. They would come out of that, and then they would have a sauna day, basically helping with drug perfusion and trying to get that everywhere throughout their body. So quite an interesting way of coming about it to make sure that we're addressing the inflammatory changes that can feed cancer, and we're helping the healthy cells and getting blood flow to all the areas that we need to. So there hasn't been a ton of studies on cryotherapy in cancer. We know that cryotherapy can reduce inflammation and can boost white blood cell count. We have seen that it can help increase natural killer cell activity, and in our patients, they feel much better. We're getting a better immune response. That's something that we kind of pay attention to in terms of like what outcome do the patients feel? Are they feeling better with it? And does it match the research? Then let's go move forward with that therapy. So we try and integrate both of these thermal therapies, if you will, in terms of cancer treatment. And I think that's something you could bring into your own world to help with immune function, keeping the healthy immune cells active and weakening those cancer cells. So temperature regulation can be a powerful thing. The lymphatic drainage and immune support. So we use like a full lymphatic drainage system where we'll do like the legs and arms. Y'all have probably seen these things. They help clear fluid, clear cellular debris. They improve blood flow, immune cell delivery, kind of clear out toxins in a way, kind of getting it out of the tissues. And efficient lymphatic flow supports the immune system surveillance and may reduce tumor, like promoting inflammation, kind of similar to like what cryotherapy would be. But I do think helping kind of get that lymphatic flowing really well throughout the body. This is also why we want to stack these things. This is where therapy, exercise would be a very good thing as well. So this is something that if we try and look for in terms of study, there's quite a bit of research on like lymphedema management in cancer, especially post-mastectomy in breast cancer, showing that like lymphatic drainage, of course, reduces swelling, reduces irritation, improves quality of life. There's some studies that seems like it helps improve the delivery of the immunotherapies and clearance of tumor-derived factors, tumor-derived growth factors. So I think this is one of those where like we use lymphatic drainage a lot because it helps people in the quality of life and the pain and irritation of treatment. And if that's all it does, that's great. I do think there's something deeper where it's kind of helping reduce the stagnant fluid that can kind of be like a pro-tumor causing issue. Helps a lot with blood flow and inflammation. So lymphedema is one of those things that we want to make sure that we're getting a handle on. And if we're already running through some of the advanced therapies, it's a fairly easy one to work in nowadays. There's a lot of access to it. And I think of all the things that people could do at home, probably one of the cheaper ones that somebody could get a device for. Some of the devices for like PEMF or infrared are quite cost prohibitive, but doing compression therapy boots or arms is something that the price has come down quite a bit over the last few years. So if we look at the overall like physical therapies, dry needling, acupuncture, I think all of these are not specific to treating cancer. If we're doing something like dry needling and we're improving the function of the body, then a lot of times what we can do is affect the immune system so that it is not responding to irritation throughout the body. It is not responding to inflammation from other areas, so that the full force of our immune system can go towards kind of, fighting cancer. So we use this stuff a lot to do specific local inflammation, improve circulation around areas that might not get great circulation, specifically while someone is undergoing cancer treatment. We also want to make sure that we're supporting immune and muscle integrity in our patients so that the cancer therapies work better. There's been a number of studies on manual therapy, acupuncture, dry needling, showing that they can help with chemotherapy symptoms, fatigue, nausea, neuropathy, and pain. That's not to be sneezed at, so to speak. I think as we've talked about on here, if you get better and better treatment, and you can handle those treatments more, then this can be a really, really beneficial therapy to give us the ability to keep going through those difficult times as we're kind of killing the cancer. So those are things that it's kind of a catch-all, and we look at many different forms of manual therapy, physical therapy, dry needling, acupuncture, as these adjunct therapies that are supportive. They don't seem to shrink tumors. I don't want to say that, but they absolutely help our patients to live better and tolerate the therapies they are getting much better. So when we're looking at side effects and when we're looking at immune function, I think while we're going through it, quite a helpful thing to include in our army of cancer treating therapies. So to kind of give you the overview of like integrating all these things and how do we do this and make sure that we're checking the boxes the right way. The main thing that we want is we want to integrate the best things. The way we think about cancer is we want to dissect it into the small components that we use to treat it. We want to look at the different areas that we need to improve so that we can get the best outcomes possible. So we want to look at things like blood flow, immune function, cell function, inflammation, and elevate the health and the ability for us to impact each of those areas. And when you break it down like that, you're like, there is good studies around these things to help me fight cancer better. And whether that is bringing in something like dietary changes, reducing any processed food, reducing any sugars, getting any acidic things out of the diet, and making sure that we're going to whole foods, clean foods, if we appropriate, going more towards ketogenic diets, and actually integrating something like a fasting mimicking program into my life. If I'm trying to prevent cancer, great, do that a few times a year. If I'm currently fighting cancer, then I'm doing it strategically timed around the chemotherapy treatments that we have access to. If I'm piggybacking on top of that, I want to make sure that exercise is part of my life. Doing that at the times that I can handle it the best. There's some cardiovascular exercise. There's some strength training exercise. All of those things are going to really help us a lot in terms of resilience, immune function, all of the above. And then looking for some of these advanced therapies. There's things that come out every day when we're looking at whether that's temperature modification, using cryotherapy to reduce inflammation, using PEMF and infrared to weaken cancer cells and boost healthy cells, using something like sauna to help deliver deeper blood flow and increase our body's resilience. There is good studies out there on a lot of these things that can help us in our fight against cancer. Our philosophy around it is that we really want to make sure that our patients get the best quality of life while they're going through this hard time, and we're educating everyone on the possibilities that are out there. There are a lot of things that people can do to improve the outcomes, improve their own health. And lastly, if you're listening to this and somebody is going through this, I think one of the best things we can do is give them power. I think knowing that you still have some control, you're not just left up to either the treatment works or it doesn't. There is some things that you can do to enhance the outcomes of this, and improve how you feel day to day, so that we don't stop living waiting for something to happen. We feel good enough to keep living and doing the things that we want to do, and that's what we want to see in all of our patients. Unfortunately, with cancer, you win some, and then it is still in a state where it can overtake the body. And in those cases, if we can make someone's time here as powerful, as beneficial, as happy as we can, then I think it's worth it for us to do some of these things as well. So hopefully that helps give you a little bit of an overview. This could have been a really 6-week class on what's out there. So without getting too deep into, different drugs and changes that are over my head in terms of the treatment side of things, these are what we look at whenever it comes to helping improve cancer, improve outcomes. So if you're still with me, thank you for joining us. This is an exciting month. We're raising a lot of money. I really hope you can share this and you can get someone to us to help us raise money on October 31st. Wear a costume. Come. We want to provide as much hope on that day as we possibly can. We're going to really break out all the stops and try and provide as many therapies as we can all day long. So I really hope that you, your family, your friends, get them over to the office. If you've ever wanted to try cryotherapy or laser therapy or infrared, whatever it might be, make sure to pencil in October 31st and come get lunch, get some different therapies in, leave feeling better and knowing that you have helped someone else in their fight. So thank y'all for listening to the Pain and Performance Podcast. I hope you have a wonderful day and an even better health journey.